Hey guys, Dr. Rob here today, and I wanted to welcome you to my next whiteboard session where we are going to talk about these 6 supplements that you just have to have for optimal thyroid function, optimal thyroid health, and associated weight loss. And I'm going to explain the supplements that you need, the amounts that you need them in. I'm even going to cover when to take them and some of the foods that these items are found in. So I got a lot of great information for you today. It's valuable for anybody. Before we get started, I want to take a second and introduce myself. For those of you who don't know me, my name is Dr. Rob DeBeese. I've been in private practice for 22 years. My clinic and I have worked with over 20,000 patients and clients from 43 other U.S. states and 23 countries. So I and my staff have been very blessed to work with a lot of people. So let's get right into it. So first off, let's talk about where this all starts. It all starts here in the pituitary gland. Actually, it starts a little further north in the hypothalamus, but we're not really going to cover that today. The pituitary gland makes a hormone called TSH. That stands for thyroid stimulating hormone. Now, in order for your pituitary gland to make thyroid stimulating hormone, it needs an amino acid called Asparagine. One of the pronunciations. So Asparagine is needed to make TSH. So guess what? Supplement with Asparagine on an empty stomach, first thing in the morning, 500 milligrams. Now, if you have thyroid medication, you need to take this an hour after your thyroid medication. So you could take it right before breakfast. You want it about 10 minutes or more before food because you want it to be absorbed on an empty stomach right into your bloodstream. So that's the first thing you need, Asparagine. The second thing you need is vitamin A. Vitamin A, believe it or not, is one of the number 1 deficiencies on planet Earth. You need vitamin A because vitamin A activates a gene that helps you make this hormone, TSH. So the 2 things we need here for TSH, Asparagine and vitamin A. What happens next is TSH gets released from the pituitary gland and thyroid stimulating hormone, of course, stimulates the thyroid. And it stimulates the thyroid to make T4. Now, T4 is thyroid hormone, also known as thyroxine, and it's pretty inactive. It doesn't really do a whole lot. But your body needs a couple things to make this. The things that your body needs are iodine as well as L-tyrosine, the amino acid L-tyrosine. L-tyrosine we want first thing in the morning. You take it with your Asparagine, and we want 250 milligrams of L-tyrosine. So you take these 2 at the same time, the L-tyrosine and the Asparagine. The next thing we need to make T4 is we need iodine. So we need a good iodine source. So we could take potassium iodide, about 250 micrograms is good. We could take a little more, maybe 400 micrograms if we really have some significant hypothyroid symptoms. But where can we get this in food? Well, we can get it, one of the easiest places to get it is in our seaweeds, right? Our sea vegetables, like all of our sea vegetables have it, eggs have it. We have it in things like hajiki, dulse, nori, which are all different types of seaweeds. Nori is the one you usually see in sushi places. So those guys, kelp, they're all loaded with iodine. Now, here's the issue. If you have Hashimoto's hypothyroidism, you have Hashimoto's thyroiditis, you don't want to add iodine. Iodine is going to stimulate your thyroid cells in Hashimoto's case, and it's going to make your condition work. For Hashimoto's, you have to do something completely different. You actually have to first find the cause of why the Hashimoto's is present. We've been doing this, like I said, I've been in practice for 22 years. There's been many patients over these years that I've helped that have Hashimoto's disease, that their antibodies just came right down. I actually just had a patient right now, three months ago, her antibodies were 356 and now they're 125. So they're not normal, but they're certainly on their way down. And she's doing much better. She's losing weight. Her brain fog is cleared up. She really feels tremendously better. So in any event, the body can change. You just have to know what to do for it. And Hashimoto's is its own unique thing, and you really have to identify the cause. It can be very different for each Hashimoto's case. So if you have a health problem, or you have Hashimoto's, or you have a weight problem and you want some help, go ahead, click on the link down below that I put here. That'll take you over to my website. You can learn more about holistic healthcare, holistic weight loss, how we approach thyroid problems. Again, we don't treat them. That's not what we do in our facility. But go ahead, click on the link when the video's over and check us out over there, and you can learn some really good information. Okay, so carrying on after my iodine disclaimer, if you have Hashimoto's, don't take it. What do we have next? So pituitary gland made the TSH, thyroid stimulating hormone, right? We needed these guys to help make that. So then the thyroid gland made T4, but T4 is relatively inactive. It doesn't do a whole lot. T4 has to go down here to the liver. When T4 gets to the liver, your body needs selenium. Your body needs selenium to convert the T4 to T3. Now, T3 is the active form of thyroid hormone. Here's the hormone that helps your skin, nails, hair, helps you with weight loss, helps you with energy, helps the brain function and focus more. So even if you take Synthroid, your body still needs the selenium. Why? Well, because Synthroid is T4, essentially. It's synthetic T4, levothyroxine. Your body needs that selenium to convert the Synthroid into the active form of thyroid hormone, T3. So you're still going to need that. Selenium, you want about 200 micrograms per day or more. You could have a little more. You can get selenium from Brazil nuts. So 1 to 2 Brazil nuts per day might be all the selenium that you need. Very high in selenium. Matter of fact, one serving of Brazil nuts, 28 grams, is about almost 1,000% of the USRDA of selenium. So Brazil nuts, you could actually overdo it with them sometimes and eat too many. So just a couple Brazil nuts per day, 1 or 2 per day, sometimes is plenty to give your body the selenium it needs to convert that T4 to T3. Now what happens? Well, let's go over here because now something really important happens. Now we got to T3, but T3, it's just potential T3. It's not doing anything until it reaches the cell. T3, much like a key that plugs into a lock and opens up the lock, T3 plugs into a receptor. So here's our cell over here. And on the surface of the cell, you're going to see all these T3 receptors. So all these red guys, those are T3 receptors. Think of like a keyhole, right? And you put the key inside the keyhole, right? So the T3 fits into the T3 receptor. And when it gets there, it then gives the message to the cell, like burn fat, make energy, all the other stuff it says. Now, there's something in your body called reverse T3. What reverse T3 does is reverse T3 blocks T3 from getting into the receptors, okay? This is important. Reverse T3 essentially, it blocks T3 from getting into the receptors. And that's really important because if T3 can't get into the receptors, it's like having no thyroid hormone at all. In fact, there is a percentage of people that have thyroid symptoms. They did have thyroid hormone problems. They went on Synthroid. They didn't feel any better, meaning they went on thyroid medication. Maybe they felt a little better, but it wasn't significant. Their numbers might have improved, but it wasn't significant. And the reason why is because their doctor probably never checked their reverse T3 levels. If your reverse T3 levels are elevated, you could take all the Synthroid in the world. If the thyroid hormone essentially can't get into your cell's receptors, it can't tell the cells what to do. The cells can't burn fat, they can't make energy, they can't improve brain function. You're just not going to function properly, okay? So reverse T3 is important. How do we keep reverse T3 in check? Well, we do it with an Indian herb called ashwagandha from Ayurveda. And ashwagandha actually helps to keep the levels of T3 in check. About 450 milligrams, 500 milligrams per day is good. You could even do less. You could do 200 milligrams at breakfast, 200 milligrams at lunch, or even just 200 milligrams at breakfast. So ashwagandha, you don't need a whole lot of it to go ahead and control reverse T3. The other thing ashwagandha does is it helps to naturally lower cortisol, and cortisol itself interferes with thyroid function. So ashwagandha, double-edged positive sword in that it helps us in many different ways improve thyroid function. So that's what you guys need. Asparagine, iodine, tyrosine, selenium, ashwagandha, vitamin A, and a good multivitamin. And of course, you need to eat good, right? Now, if you're out there and you're struggling with a health problem, you're struggling with a weight problem or a thyroid problem, please take a minute, click down here on the below link, check out my website, learn about holistic healthcare there, learn about the thyroid and how the thyroid functions. I even have a free online thyroid and weight loss evaluation, which actually helps move us in the direction of identifying the underlying cause as to why a person has their thyroid problem in the first place. From there, we actually can give a person a free consultation with either our certified nutritional counselor or our naturopath, and we'll talk to you guys. We'll give you some free advice, and we'll also explain how we can help. So if you choose to work with us, great. If not, not a problem at all. There's no pressure. We are just here to help, and that's it. So I hope you guys enjoyed this whiteboard session. Please go ahead, click on the like, give me a thumbs up. Leave a comment if you have any questions in the comment section. Share this information with a friend. Sharing is caring, and I want to get the info out to as many people as we possibly can. So thank you very much for being here, guys. I appreciate your time. I know your time is valuable, and thank you for spending it with me tonight. And I will catch you at the next whiteboard session. See ya.